Welcome back to this final part of Body Garage, where on this episode we are focusing on glaucoma. And just before the break, we have learned some of the treatment options available for glaucoma. And now our set has changed, Daktari. We do have our patient here. Could you take us through now this test that you probably look at when someone comes in to your desk?
Yeah, we call this a slit lamp, which is a microscope that examines the tissues in front of the eye. And occasionally we use some lenses to look at the inside of the eye. On the side here is an attachment that we call a tonometer. This is the gadget that we use to measure and estimate the intraocular pressure. Once the pressure is anything less than 20, we are okay, but we still have to look at the nerve to determine the health of the nerve. If the pressures are high, then we have to consider the prospects of starting treatment or close observation until we are sure there is damage because of eye pressures.
Okay.
Yeah.
All right. So let us see it now practically. What does he have to do?
So all you need to do is put your chin here and press your forehead on that band. We will use a bit of light, so sometimes the light dazzles, but I would ask you to look at my ears. So I'm going to examine your right eye first. So look at my left ear. And this light gives me an opportunity to examine the front of the eye.
Just the front of the eye?
Yes.
Okay.
The various parts. I can see clearly how your lid looks like, how the conjunctiva is, the health of the cornea, and any other tissues that may be present that need not be there.
Okay.
And we always examine both eyes. Yeah.
So right now he gets to see your right ear.
Yes. So just look at my right ear.
And Daktari,
Yes.
You said that sometimes with these machines you can see even to the back of the eye.
Yes.
So this particular machine can do that?
We can, only I did not carry the lenses that we use for that purpose, but we call it fundoscopy, examining the fundus of the eye, which is the back of the eye. And we have various methods. We can use this slit lamp. We can also use the machine that is just the gadget that's behind you to look at the inside of the eye. And that is the purpose of the whole examination.
Okay.
And we try to do this for everybody that walks through our clinics. As we said, glaucoma is a silent thief. There will be no pain, no symptoms. We catch it because we purpose to look for it.
Okay, Daktari.
Yeah.
So how do his eyes look like?
The eyes are basically healthy. He has some growths on the surface of the eye, on the part we call the conjunctiva. But these are benign growths that will not cause him any problems. This morning I've seen quite a number of them, and that's all that brought somebody to the hospital. We call them pinguecula. This need not worry you at all. Yeah.
What causes those growths?
There are growths that occur in some people. So it is said that exposure to UV light, but then all of us are exposed, but only a few have the risk to develop them.
So could those
You can rest.
Tissues go away, the growth? Does it go away with time?
They will be part of the features of his eyes.
All right.
Yes.
What are those tips you give some of your patients?
Live a healthy lifestyle. If you eat well, a balanced diet, then most conditions that bring us to the hospital will be taken care of. Unfortunately, you have no control for things like glaucoma. Theoretically, if you were to avoid UV light, then you also reduce your chances of getting cataracts. But we live in the tropics where the sun is there 12 hours a day. It's very difficult. But even if you do, you only reduce the risk, you don't eliminate it. So those are some of the things. People will use UV protection if you can afford them. It reduces the chance, doesn't eliminate it. So your momentum for good, prolonged eyesight is to visit your doctor periodically.
Okay.
Especially if you are above 40. If you are younger than 40 and there is a family history of any eye disease, then you need to come even earlier.
And when I was growing up, Daktari, just on general eye health now, they said that taking carrots is good for the eyes. How true is that in the first place? And are there, foods that are good for the eye?
Yes. It is true to a point, but it is also misleading. Carrots, we know, are a good source of vitamin A. So are the green leafy vegetables, the sukuma wikis, the sagas, the spinach, and other foodstuffs, liver, eggs, red meat, will also give you enough vitamin A. Now, vitamin A is essential for the health of your skin, and the eye is derived mostly from the skin during embryological development. So yes, the health of your eye. If you are born short-sighted, you are born long-sighted, no matter how much vitamin A you take, it's not going to help you. But the health of your eye first, because if it is not healthy, then it's not going to see well. Yes.
Okay. For glaucoma, you said that sometimes you measure the thickness of the cornea. Is it something that we can see?
If you have thick corneas, this measurement, this machine will give us a higher pressure than normal. So we moderate it and we find your actual pressure. If you have a thin cornea, just a little dent, and then it will give us a very low reading. And if we moderate it with the formulas that we have, we will tell you actual pressures. So you may go somewhere and they tell you your pressures are normal, but your corneal thickness is very thick. And over a period of time, we notice that you have damage, continuous damage. And when we check that, we find that we've been wrong all along. So it would be good to do all those tests. It's not available in many centers, but we are fortunate to have it, and so are many other centers within Nairobi. Yeah.
For people who are short-sighted or long-sighted, how do you advise for them to take care of their eyes even after, getting spectacles for their conditions?
Again, just a healthy diet to keep the eyes themselves healthy. But you have to use your glasses regularly to be able to see far. If you are short-sighted, they are lucky they can read from near comfortably.
Yes.
If you are long-sighted, reading becomes a problem. So you have to use your glasses consistently for reading and doing your other chores. But it is not going to reverse the condition.
It cannot be reversed.
There are some surgical procedures, newer laser type of surgeries that can reverse, that are available. For people who can afford it, they can go for it. We haven't started it here yet because we still have a lot of other eye conditions to grapple with. Our hands are full, but as we develop, that may be an option in the future.
Daktari, if I could take you still on this matters eye health, why is it that for someone who is already on glasses, say someone is short-sighted, why is it that their lens keeps increasing? And how does spectacles now come in to, solve that condition?
Let me start with the amusing part of the whole situation. When somebody wears glasses for the first time and they see well, after some years, they lose their glasses and they claim their vision is worse than in the beginning. Yeah, sometimes it's true. Most of the times it is not. If somebody removes you from a disadvantaged environment, when you come back there, you start to see what you never saw before. So you think you are worse off. That's one. Secondly, for younger people, they're still growing. If you are short-sighted, if this was a normal eye, your eye is theoretically larger than normal. And as you grow, it becomes larger. So your short-sightedness increases. And that's why they have to change glasses periodically. Not really every year, but maybe every 2-3 years. The younger you are, the sooner you'll change your glasses. Okay. Some people will change it religiously every year. It's not necessary, but you need to come, you'll be rechecked. If the growth is faster than normal, then we have to check for other conditions. A common one being something we call keratoconus, where the front of your eye grows out of proportion, and that needs to be checked. The more reason why we need to have an annual check. So long as you have an eye condition, you need an annual check. If you are normal, you live your life, let's see you by the time you clock 40.
Okay. Yeah. What are the conditions of the eye that would need regular checkup?
The commonest is allergy. And allergy, almost a third of what we treat in the younger population is allergy related. Number one, because it makes you uncomfortable. Number two, the frequent rubbing of the eye may cause other problems. Number three, the commonest treatment for allergy is steroids. And once you use steroids for long, you could develop glaucoma or cataracts. And then your doctor needs to keep tabs on you, that you do not treat the allergy and end up with an irreversible cause of blindness. Yes.
Okay. What does a healthy eye look like? Is it white? Is it red?
A healthy eye is never perfectly white. It has blood vessels, and these blood vessels make it appear. But there is an acceptable level of whiteness that we accept, and anything that causes the eye to be red raises an alarm. And there are things we have to look for, because there are other conditions. Some are inflammatory, like conjunctivitis, uveitis. If you have a foreign body in the eye, it immediately becomes red, and that tells us where to look for. Yeah.
Okay. Perhaps your final thoughts on glaucoma and tips for living with it, and for some to prevent it, even as we commemorate the World Glaucoma Week.
First, we need to recognize the fact that glaucoma has no symptoms. So let us take the step to have our eyes checked specifically for glaucoma. Two, if you have any relative who has had glaucoma, you need to go earlier. Three, glaucoma can be managed to reduce the rate of destruction of the optic nerve and reduce your path to blindness. Also, once you have glaucoma, we do not promise that you may not go blind. But what if you go blind? Life must continue. There are rehabilitation processes that can make you be as independent as possible. I've seen a shopkeeper who is blind. I've seen a farmer who is blind. My good friend Wanyoike used to be a marathon runner, blind. And we mentioned Crystal Asige. These are people, members of the society who have kept high-profile states despite the blindness. So don't sit back because you're blind. You can be rehabilitated to do even things
that are
you
greater.
never imagined you could do.
All right. Asante sana Daktari for taking us through this. It has been a pleasure. And for you back at home, I hope it is now your time to see that perhaps you need that regular eye check. You should consider it. Thank you for keeping it TV47 and Body Garage with I, Sheila Chelangat. Until next time, it is good night and goodbye.